This is Life as a Blind Person, and I am Sassy Outwater Wright. I'm the Executive Director of the Massachusetts Association for the Blind and Visually Impaired, or MABV, and I am coming to you live from the grocery store. This is one of the main places that we're having trouble accessing as a community during the COVID-19 outbreak. The blind and low vision community is having some extraordinary difficulties getting groceries. And I'm not just talking finding toilet paper here. I'm talking about being able to access food safely and without being socially harassed. We're seeing a lot of people with low vision who have to put their faces closer to labels to read, or who have to take longer to magnify labels and read, be shamed by the public for getting close to labels and food with their faces, or for taking time when everybody wants to zip through, get in and get out to be safe. And I hate to point fingers here, but society, this one's a little bit on you. We told you over and over and over for the past, 70, 80 years, longer than that, to make labels accessible to people who are blind or who have low vision, and that didn't happen. And so now, those of us who are blind or who have low vision, who have to go into the store to shop, can't access food independently. So we have to bring somebody with us or ask a store employee for assistance. And store employees right now, stores are understaffed, employees are busy, and they can't get close to us. We can't use a human guide right now because of social distancing guidelines. We have to stay 6 feet apart. And for people who have low vision, it's very hard to follow somebody when you have to stay 6 feet away from them. So there are a number of problems that we're facing. I myself yesterday was at the store picking something up, and somebody had to read me some food labels, so I made sure that the ingredients were safe for me to eat. And the person behind us got very impatient and angry that it was taking us so long in front of this particular display, and she decided to make some pretty rude, snark comments at us about it. That was uncalled for. It takes everybody time. We all can exhibit patience and kindness. Fear is running high, patience is running low, and that's a recipe for tempers to be short. And we need to be extraordinarily kind and compassionate and careful with our behaviors out in public right now when we do have to go out in public. And I would love to say, everybody get grocery delivery, but right now, as Instacart workers strike so that they can get safe working conditions, and as Amazon Fresh workers are striking, this is only going to get worse. Those are the systems that a lot of blind people rely upon to get their groceries delivered, and now people can't find appointment times for delivery, or there's nobody working because they're on strike trying to be safe and to take care of their own families and to get sick leave, which they need, and it just affects our community even more. So there are some pretty extraordinary circumstances, all adding up to a big problem here. Asking friends or family to go shopping for you is one solution. We're also working to remobilize our volunteer force to help with this problem. We're looking at technological tools such as online ordering, but that's not always a great solution. We're even looking at things like the Sunu band to help with social distancing so that you can feel vibrational feedback when you are 6 feet away from somebody and stay safe and keep them safe. So we're reaching for every tool we can that adheres to the guidelines that are currently put out by the CDC and the Department of Public Health. But those guidelines change all the time. And so the moment we think we have a solution, we have to hit the table again and do more research and reevaluate. Everything changes day by day. So we need to ask right now for the public to be aware of what we're facing as a community. And as a community, we need to come together to share resources. One of the other things I'm seeing is that older adults who are blind or who are brand new to losing their eyesight haven't had the training to use a cane or a guide dog. They feel safer using a human guide to go out into public, but they can't do that right now with very many people because of the social distancing guidelines, and so they don't feel safe going out in public. And a lot of times I'm seeing the blind community push back on that and say, just use your mobility tool. Not everybody has enough training to safely do that. Not everybody has adjusted emotionally to doing that. And there's an unfortunate overlap there. Yes, we need the tools to be self-reliant and resourceful, But if we're not comfortable using those tools or haven't emotionally adjusted, that doesn't mean that you don't need to eat right now. That doesn't mean that you don't need to access things right now. You still are a human being, and you still need to have the basic human right of food access. So we as a community need to be compassionate, we need to be careful, we need to be safe, conscientious, and supportive to one another, no matter where we are on that adjustment spectrum. We will be looking for every and any opportunity to reach out to stores, to businesses, and say, what are you doing to serve the blind community? Drive-through pickups for groceries don't work for us. Delivery services aren't going to always work for us. So we need to continue to have solutions, such as walking into the store, picking up your groceries, paying and leaving, and the store employees shop, such as being able to have people who can go shopping for you, such as volunteers, and safely make that financial transaction and the drop-off of those groceries. We are exploring every opportunity to make sure that this issue gets addressed. And this also goes for prescriptions, refilling prescriptions and getting them delivered. Working with pharmacies, working with doctors' offices, making sure that the business and medical community do not forget the disabled community and the blind and low vision communities as they make plans for how to deal with all of this. Stay safe and take care.